Okay, I got read my bit of paper up here. I would like to remind everybody that some of the instructions included in the remote meeting protocol. Everyone will be muted, and if you ask to speak, go and mute yourself, speak, muted yourself again, and then you finish. If you have a question, press the virtual hand on the screen, and the chair will invite you to speak, one person at a time. Please do not begin speaking until the chair invites you in. If you have a comment to make, you should only raise your hand when the chair asks for comment. Again, you will be invited to speak, one person at a time. If for any reason for a member calls to leave the meeting, then you must indicate this to the chair before meeting. Please raise your hand or send a message on the outline chat. Case law is clear. You are not allowed to vote if you haven't heard the full debate. So if your screen freezes, you have heard the whole debate, you may use your discretion or whether to vote. However, if you did hear it, the whole debate, you cannot vote. When we come to recommendations, you're invited to vote. At the time of the meeting, it says at the start, please could I ask all officers and guests to turn off their cameras so that only elected members and lay members on the screen. You should turn on your camera, microphone while you're speaking on the sit down, but please turn them back off again afterwards. Could I please ask the service to remove everyone and begin the recording that was referred in the published agenda? Number 9. Good afternoon. Welcome to the members of the Typical County Borough. It's a common meeting. Please note that this meeting recorded and may be broadcast on authority's site. Images of the sound recording also being used for training purposes with authorities. So we'll go for the agenda. So I've done my bit now. All right. So we kick off the agenda. Please note today's meeting will be recorded. The recording may be on the broadcast in the local authority's internet. All attendees will be viewed by the camera, and by attending you consent to begin filmed, possibly use images, sound recording have been used outlined above. Number 1, any apologies, Matthew?
We haven't had any, Chair, none at all.
Good, full house. Number 2, declaration of interest. I'm not going to read that now because I read enough today. And number A and B, that's down by there. That's usual. So you please note A and B, and then we go to number 3. Lisa, to take us to the budget.
I am, yeah. Okay, I won't read through the report verbatim, but I'll just sort of highlight some things. So as in previous years, we're bringing the budget at month 5, even though we're in October. Month 5 is the one that's been reported. I have to say this year the budget's been really unpredictable due to COVID. It's put some increased sort of demands on the service with regards to direct payments and agency workers, even though we've seen some decreases in demand for care home placements and day services, but you'll see that in section 5 with regards to the budget. So the budget today is at the 31st of August 2020. What I will say to you is that you'll see an overspend, but the current budget, we are actually underspent. So the budget position has changed since August, but I'll update you again in the new year with regards to the current figures. Where we were last year, we were able to balance the books, and we did contribute to the financial savings because we had some Welsh Government winter pressures money in March this year. So that helped with some of the areas of the overspend. We continue to use the Integrated Care Fund, which has helped us with some of the innovative projects moving forward within Merthyr and across the region in Cwmtaf. We've invested monies in the changing structures in children's services, so that's helped in sort of development of the support and change team, and with the creation of a generic team helping and looking around the CLAR reduction. So that's reduced, or hopefully will reduce our need for agency staff in the future. The anti-poverty steering group continues to sort of function, and that helps us review and monitor the various grants that are available to Merthyr and make sure that we're using those across the service and not having a duplication of service. The section 5 of the report goes through each budget line, and I'm happy to answer any questions on that rather than go through the detail. The first part is specifically the budget and where we're overspending, and then the second part highlights the areas of the biggest variance. So you'll see the homes for the elderly, that's an area of overspend, the independent domiciliary care, the IRE budget, children with disabilities, the LAC residential budget, which is a big overspend, and fostering. So there's some of the variances in the budget. Obviously, where we'd want to be is have a balanced budget, and I can say that we are currently underspent in October 2020, but obviously, as you know, that could change by tomorrow. We could have another LAC child in, and that budget can change quite considerably. Obviously, what we need to do next, we continue with our regular finance meetings with our finance colleagues, and that's been really positive over the last year. Those meetings have continued. I attend budget board meetings monthly, and we're challenged there by other officers. We obviously look at various projects in the past where we're looking to reconfigure the residential homes to stop some of that overspend there. That has been delayed due to COVID, but some of the building work has now been done, so we'll be looking to do that now in the next couple of months. We are continuing to work regionally with our neighbouring authorities and the Health Board on ICF and transformation of services both in children and adults, so that's helped us gain extra funding from grants in the past. We've also had extra monies around COVID, and although that's been focused on adult services to date, we are expecting sort of children's services monies in the near future through grant. Also winter pressures monies, which we'll see now before Christmas. So obviously that will have a huge impact on the budget and help us sort of develop some services moving forward. And then I think that's it really from me. So if there's any questions.
Yes, thank you very much, appreciate it. Ian, I see your hand up.
Yes, there's an underspend there in the community stores, whatever, integrated stores. Is that in any mean causing delays to discharges from the hospital, blocking beds? What's the reason for the underspend?
Angela can probably give more detail than myself, but it's certainly not having any effect on discharge. If equipment is required, then obviously that's being supplied as and when it's required, and we're moving on that quite quickly. The underspend may be due to the fact that there's been reduction in demand over the last couple of months with regards to sort of, the number of referrals coming through the front door because of COVID, because certainly early on in the pandemic, we were finding that certainly adult services, they didn't want the service because of the risks, and they feared people going into their homes. From a discharge point of view, the thing that's causing delay there is the fact that our care homes have got COVID in them at the moment, so we can't accept discharges from hospital where they can go into their own home. We are pushing those forward now and doing that much quickly, and we've got an agreed protocol with the Health Board which was signed off at Gold within the last couple of weeks. So anybody can move into the community, and if it's down to sort of needing equipment, then we do that quite sort of efficiently. But I don't, Ange, do you want to add anything to that?
Yeah, thanks, Lisa. One of the reasons is early on in the pandemic, what we saw was we were reducing the number of OTs who were going out. So they're only going out in exceptional circumstances to reduce the risk of cross-infection. But at the last meeting, what we've seen is that incrementally now they've caught up with it. So we've seen a considerable increase in the pieces of equipment that have been issued in the last couple of months, but that doesn't yet reflect within our budget line.
Okay, thank you both. That answers my question. Thanks.
Lisa, on that question, if an underspend and under you, do that keeps in the local authorities because of the quota system, or that goes back in the pot?
I think it stays with us. I mean, obviously we budget for the whole amount, and if need be, we buy equipment for storage.
Right,
so it's just used to buy equipment, so I don't think it's something that's handed back.
So we don't lose it.
No.
Okay. Any question, anybody else?
Yes, have I got my
Yeah,
hand
there'll
up,
be
Bill?
another question. Right.
Thank you, Chair. Lisa, I think you're doing remarkably well to keep the overspend down to 0.3% at this point in the year. So congratulations on that. But the question I'd ask, the worrying thing to me, it's cropped up before, is this very large overspend on the children's residential placements. You showed about £1 million. Would it be better maybe next year to try and put a much larger figure in right at the beginning so that it doesn't overspend?
Okay, thank you, Councillor Thomas. That's certainly something we've looked at, and I know in the last couple of years we've had to put growth into that budget line. We did look at our prediction for residential lack, and we predicted that we probably need about 13, 14 placements this year. So there was monies put into that budget line growth last year. Unfortunately, we've had an extra one into that budget line. Plus, we've had sort of some more complex cases where they've needed more one-to-one support, which obviously increases the cost. And some of those placements have been outside of Wales. So, and sometimes more complex and more therapies involved. So the costs go up again. Certainly something that we do look at as part of the medium-term financial plan. So it will be something we'll look at moving forward. The other thing we're looking at is where obviously Welsh Government looked at giving local authorities capital monies to look at developing their own residentials, and moving forward that's maybe something we need to think about, and we're certainly in the process of developing a business case to try and think about how we can manage this in the future. There is a project called Closer to Home where we are looking to bring those children and young people either back into the borough or step them down into foster placements. So less cost, but also better outcomes for themselves. So we've had some success during the year. So we've had one young person recently step down from residential to fostering, and we need to continue that piece of work. And that's certainly something Taran will take forward as new head of service.
Thank you very much, Lisa.
Anybody else? Any question, Lisa, on this? Lisa's very quiet.
Very quiet today, yeah.
No. Can I say as a chair, I think this is an excellent report, especially the 12 months, the months we go in since March with this COVID disease coming through, have changed everything, especially for the social services, because we deal with the older people. Right? And be honest, it's up with us, they're going down like flies, people. It's unbelievable. But it's the older generation like being it. But the work you're doing and your staff, and you don't forget your staff, you've got to work with them as well. I could be close working arrangements, and it's not simple as keep a distance, is it? So I think your department is doing an excellent job, and your staff. So that's my agenda. Anybody got any comments or any other questions before we move on?
Chair.
Jack?
Lisa, I'd just like to echo Bill's comments. The committee fully understand the pressures you're under, and obviously we'd like to say well done. I'm just wondering if, as in table 1 in the report, when you're bringing it back next year, the budget, would you be able to put in the actual budget figures that it was set at the start of the year, just so it saves us trying to do mathematics, to be honest, which I was never very good at, and it just makes it easier for us to understand, if you don't mind.
Yeah, that's no problem.
Lovely.
Please
Thank you.
remember, we discussed that last year. Do you have the figure then? Do we top the page? How much we get there? Now it dawned on me that we just discussed that last year. Do you have the figure on top of the page? What social services allocated to? And working from there. But they're going to be split in departments, aren't they?
I'll do that next time.
Okay. Okay.
I just got one, Bill, Chair.
Go on, carry on.
Thank you. Thanks, Lisa, for the update. In relation to 7.3 on the report, you talk about the additional services through the Integrated Care Fund and the Transformation Fund. to allow innovation to continue across the region. And it mentions in relation to adults, the developing phase 2 of the Stay Well at Home programme. Can you just give me a little bit more information on that and what impact that's going to have over this winter, please?
I will ask Angela to answer that because she'll have certainly more detail than I would.
Brilliant, thank you.
Better sort of answer.
Oh, thanks, Councillor Jago. The Stay Well Home 1 programme was very effective in supporting people to return home rather than be admitted to hospital. And building on the success of that, we've looked to develop a mechanism to stop people having to go to hospital in the first place, so they wouldn't need to get to hospital to have that decision made to provide a support package for them to return home. So Stay Well at Home 2 is looking at opening social services front door from 8 in the morning till 8 in the evening during the week and on the weekends. But this is phase 1, and at this point that access is only for other professionals, mainly WAST, GPs, district nurses. And the purpose of it is if a district nurse goes into someone's home or WAST and identify that person could potentially be likely to be admitted to hospital, but if we could provide a package of care within 4 hours to support them to remain at home, then that can be facilitated through going through our normal duty number, and then they will arrange for that package of care as soon as possible. And then, of course, it can link into all the other community services, such as medication at home, which was set up as part of Stay Well at Home 1.
Fab, brilliant, thank you. I was aware it Stay Well at Home, but I didn't know what the 2 was. So yeah, that's really useful. Thank you.
Okay, everyone all right? Thank you. So we go on. These sacraments are report. So who's take this? Carlos, take us to the transition for young people. Liwen?
Fab. Thank you very much, Councillor.
Hi, sorry, love.
Okay. Fab. So I won't take members through the level of detail that's in the report, but give just a brief overview. So as corporate parents, we're always on a continual journey of exploring the ways in which best we can work with our young people. And I think that this report really does encompass and reflect that. So the report before scrutiny today takes you through the legislative context of our duties under the Social Services and Wellbeing Act, as well as the key messages from policy, legislation and research. So I won't go through that in detail. The Children's Looked After Team and Care Leavers Service sits within the permanency service of the Children's Services structure. And transition for our young people commences when a young person is 15 3/4. However, obviously planning for transition to adulthood is embedded right throughout the support that we offer our young people. The offer that we make to our care experienced young people extends to their 25th birthday, and we have a dedicated part-time young person's advisor for our care experienced people. In terms of where we were, so in June 2019, members will see that Children's Services, following consultation with our care experienced young people, devised a care leavers strategy called Make My Own Decision, and the naming of that was agreed and made by young people. In February 2020, we provided Council with a full report on our pathway to work, and you'll see that that's referred to several times within the report. In July 2019, there was a change in our care leaving service provider to Thlamai. In terms of where we are now, in 2021, we've continued to build upon our ethos of early transition planning for our looked after young people, and subsequently Children's Services and Adult Services have worked together with multi-agency partners to establish a transition planning panel. We've also drafted transition guidance, and that's currently with partners for consultation, and there will be information brought to members when that comes back from that consultation process in order that it can be ratified. The local authorities offer to our young people to support their transition into adulthood includes accredited independent living skills training, preparing our young people for independence, including ensuring our young people have somewhere safe to live. And that can be done through a range of options, such as When I'm Ready support arrangements and independent living support. And we've worked with other areas of the local authority, such as housing this year and the third sector, to promote our care experienced young people having access to good quality affordable properties. And I think that's really key, actually, that good quality affordable properties. There remains within the local authority insufficiency in terms of capacity of affordable one-bedroom housing, and we're currently exploring further options with housing about how we increase that capacity. However, it's important to note that this year we've seen the launch of our Housing First project, and Housing First offers high quality flats with access to on-site 24-hour support for our care experienced and looked after young people. The Children's Looked After Education Service LACES continues to work closely with educational, personal advisors and the third sector to promote the attainment of our children looked after and care experienced young people and their transition into college and other academic avenues. During the past 3 years, the LACES team have been central to the development of the class-friendly schools, and you'll see further detail on that within the report. We've launched our work opportunities for young people in our in care or leaving care policy document, and that's a 3-year project. Again, there's some details around our targets within the report. And in line with our Pathway to Work project through the Integrated Care Fund, we've employed an employment mentoring and support officer role. We've continued to work collaboratively with Voices from Care, who facilitate local group meetings and opportunities for our young people to meet, albeit virtually at this time due to COVID. It's important to say, actually, that this year the global pandemic has had an impact on where we would have liked to be in terms of transition planning, but our policies and strategies that adhere to this, we've looked at how we do things differently so that there's no drift in how we move forward. So our Children Looked After have seen a significant educational success this year, which I think is really important that we celebrate, and we've seen an increased level of attainment in terms of those receiving their GCSEs and A-level results. We've also recently undergone a Care Inspection Wales inspection in October, and one of the areas that they looked at was our care leavers service, with a particular focus on transition, and we've had some positive feedback in respect of that, and although that's been verbal to date, and they've commented on actually corporately how children looked after is a high priority and that corporate parenting is visible and that there's good political support. They've also commented that they consider our care leavers to be an appropriate accommodation with good support from both the third sector and the local authority. They've also given us really positive feedback in terms of the change of our provider to Thlamai and the service delivery to our young people. So in summary, that's the contents of the report. I'm not sure if there's any questions or queries.
Tara, thank you very much. Appreciate it. There's a lot there to take in. Very good and very good work. Cheryl, your hands up.
Thank you, Chair. Thank you, Taran, for the report. In terms of the care leavers, I just need to try and put a bit of perspective around the report. So, in an average year, how many care leavers do we have that come out of the system within Merthyr?
I think it's fair to say that that really is a figure that fluctuates every year, and to give some context and figures that I have to hand. So between now and March, we will be looking at there will be 8 young people who will become care leavers. But what I will say is looking at the breakdown of our children looked after figures, that can fluctuate quite significantly, but it is something that we make sure that we always have an eye to so that we can plan to sufficiently support those young people.
Right, okay. I was just conscious that there wasn't any reference to numbers in the report, and it just gives it a better perspective, really. When you were talking about the children looked after and the positive results from the school, from their education, their GCSEs, etc., from their last sets of examinations, again, it would be useful to just see the numbers, to see, you know, how many actually sat any sort of examination, what the results were, so we can celebrate those successes, but also where the gaps are, so how many didn't sit any exams, or whether they sat them and had very, very low results, just to really give us a flavour of where they're at, really, in terms of, you know, their progression, you know, in future into adulthood. And the other question I had was around, oh sorry, I've moved it now. Item 5.7, when it's talking about the work opportunities for young carers leaving the system. For this year, 2021, it says you aim to make four work experiences for young care leavers. So has that happened, and can you give me a flavour of where they do in that work experience within the council this year, please?
So in terms of the figure for this year, as we've noted in the report, that has been impacted on by COVID in terms of exploring those work opportunities. I do know in the workshop that we had, we went through in detail an example actually of one of our young people and the experiences that they were able to gain this year through that programme. I'm obviously more than happy to provide a breakdown in future if members would like to see the nature of those settings and how many young people go to different settings, if that would be of assistance.
Yeah, that would be useful, because this is something that I requested last year in terms of looking at the apprenticeships for our care leavers, and that my rationale was, you know, if we as parents had our own businesses, we would look to provide opportunities for experience for our children, and I think we should do the same as a corporate parent with our children within the system as well, you know. So this is where it came from last year, really. And I'd really like to see it, you know, it progress. I appreciate COVID this year has hit, but obviously we'd like to see it moving on. In terms of where we go next, it does make a reference on 7.4 around building the pathway to work project moving forward for 21-22, and also the sustainability of financing this moving forward. I just really hope that the local authority takes up the government initiative that's available at the moment that the local authorities can sign up to, and I'm not sure if Merthyr has. Let me just pull up the details of it. Oh, I can't find it now. It's the Kickstart scheme. So right. It only came out at the beginning of November, and it certainly was a response to, you know, the pandemic that we're under as well. But it is basically the government are providing full funding to employers to take on job placements and provide 100% of the funding, minimum wage for 25 hours a week. Now, this is perfect for our care leavers. We've got a local authority with lots of different departments and opportunities. So I really hope that Merthyr as a local authority will, if they haven't picked this up, pick it up quite quickly. Particularly with regards to our care leavers as well, you know. I know the opportunity is available for everybody across the board, but I think we, you know, as corporate parents, we should be definitely exploring this opportunity moving forward as well.
And I would concur, Councillor. I think it's very important, isn't it, that in addition to our pathway to work, we maximise any opportunity Absolutely. We can for our care leavers.
Yeah.
As you pointed out earlier, isn't it? It's about us acting as a corporate parent and doing for our young people what we would do as parents for our children.
Definitely. And if you're saying that we've got 8 that will be coming, leaving us between now and the end of the financial year, wouldn't that be amazing if we could have 8 work experience placements for these young people, paying them minimum wage for 25 hours a week through different departments within the local authority? You know, I don't think that's completely out of reach. Do you know what I mean?
Yeah. Yeah, like I think it's definitely something, isn't it, that needs to be explored, and we would be more than happy to provide feedback, obviously, on what we've achieved this year in that regard to scrutiny next year.
Fab, thank you. Thanks, Chair.
All right, Gareth, your hand up.
Thank you, Chair. It's a sort of follow on from what Shrell asked, really, regarding paragraph 27, Taran. Is that a rolling programme? I wasn't clear, really. You say in year one that there is 4 work experience. So that in the second year, then, are there 4 new work experience people? Or is it only the traineeship is in year 2?
So, Councillor Richard, that would be a build upon. So we would be looking in the first year for the 4 career experienced people to be in council settings, and then an increase then of the 1 traineeship. So we wouldn't be
So it would be 4 and a traineeship then in the second year, and then it moves on. Yeah, that's clarified. Thanks. And in paragraph 10, Taran, regarding the face-to-face contact. I lost my thread, sorry. In the transition, obviously, because of COVID, there's not so much face-to-face contact. Is that having any detrimental effect on the sort of scenario or not?
So in terms of the functioning of children's services, Councillor Richards, then face-to-face contact is still taking place between social workers and our young people. Obviously, we are looking to maximise virtual means where appropriate, but we do have statutory duties, and a large proportion of those visits are undertaken face-to-face. We are finding a number of third sector organisation or partners are doing primarily virtual sessions, but obviously that's something that we're monitoring and giving feedback on, because we most certainly wouldn't want that to be detrimental to our young people. And probably important to note, in terms of stability and transition planning, we are as committed to that during this pandemic period as we are outside of it. So we very much are still committed to planning for our children in a way that is in co-production with them and includes them in decision making.
Yeah. Thanks, Taran. That's fine, yeah.
Okay.
Yeah.
Chia, who's that? Come on. Tony Rogers. Tony, can you hear me?
Is that me?
Yes, you.
I'm coming up.
Here he is, man.
Yes.
Yes, come on, Tony, wait then.
Can you hear me?
We can hear you.
Germany calling? No. You can hear me. Yeah, I've got to be quite honest with you that Cheryl Lee, Councillor Jago, covered most of my points, because I wanted to work on the aspect of employment. This is the bugbear in my mind, and I've done so much work over the years as a youth leader and with NEETs, etc. But I enjoyed your presentation and your confidence in delivering it, Taran. But what I'd like to see as well, because to be fair to Cheryl, she's done a very, very good job there, Shirley. What I'd like to see as well is combinations of working together with other departments. Should social services tends to be isolated on its own, but I think all parts of the local authority should come together and make a concerted effort, not only for employment with businesses, etc., but to try and create employment. That's what I'd like to do. I have a lot of ideas, actually, but this terrible COVID thing have knocked me back, and I can't, not me personally, but I've knocked the ideas back, because it's very difficult. We've got to survive now. That's what we've got to do. So I'm difficult about that. So what I'd like to see is a combination, come together with our departments, create and develop this employment for people who have obviously been in transition, etc. So, but thank you very much.
And just to provide some feedback, Councillor Rogers, I think is probably important to note that we will concur with a lot of the views that you've just shared, and I think that's why we were very mindful in terms of when the post was created for the employment mentoring and support officer, to ensure that they were placed in the best place in the local authority. So they are actually based within the employability team, because they can already use the pre-established links that are there that we can then maximise. And I think we were very mindful that by placing them in children's services, potentially that wasn't the best place where they could be most effective for our young people.
All right, Tony, any questions? Tara, on the how strong are the links with other departments working with children? Are they very strong or lip service? But are they strong?
What I would say, Councillor Smith, is I think links with any department could always do with strengthening, and I think that's something that we should always strive to do. However, I've been in Mercer Children's Services for 13 years now, and I'm of the view that this is the strongest I've ever seen working links across departments. And I feel very well supported as a head of Children's Services that corporate parenting is a priority. So I suppose it's important to say that from my perspective, that can always do with strengthening. And if I'm here another 13 years, that will probably be the message I will say then. But I think we are very well positioned actually to make sure that we maximise our resources for our young people.
Well, how do you think we can make it stronger then? Because people move on, people change about in different departments, and then they lose out a bit, especially with the scorers. It could be all gone next year, fingers crossed. But again, do we keep the same strength?
I think we've probably got to a position that our working links with other departments are very well embedded now. So I feel confident that they're not solely based on individuals' working links. And I think there always will be a strength in individual working links, but I don't think that is the crux of it. And just to give you some context, Children's Services have been exploring something today, and within 15 minutes, a member of housing was available to me for some consultation on it. So in any given working week, I will have numerous meetings with other departments to look at how we support our young people. So today alone, I've met with education in one meeting, housing in another, and that's just in one day.
Good, excellent, because I think the report is good. It's totally different reports we had over the past, to be honest. It opens people's views out, right, about care leavers and bits and pieces. So I think it's good. But I think if you want any problems, come back to us. And you can tell other departments that we are looking into it, because we don't want to lose this now. You know, it took us a long time to get where we are as a scrutiny, and we want to take it further. Members agree with that. So we want to prove a point that we're not just there lip service, we want to make a service.
Councillor Smith, I wondered whether I could come in.
Yeah, no problem.
Thank you. To be fair to Taran, I will give credit to her. She's written a fantastic report, but I think it's fair to say a lot of this work was already put in train by her predecessor in terms of obviously Annabelle. It's just really fantastic how Taran has brought all of that up to date. I think there's some fantastic questions have come from members today, and I obviously in my role as the chair of the council's corporate parenting board just wanted to kind of just respond, because I've been corporate parenting board chair now since obviously the May 2017 elections. So I've probably been one of the consistent persons in the development of the pathway to work. I just wanted to say really that you know, a huge amount has been done. Councillor, you've all raised some fantastic points. Councillor Jago's really put some fantastic challenge across to us in terms of what the Children's Commissioner has said to local authorities and public sector about the hidden ambitions. And that's about creating opportunities in the family business, which is the local authority. So as we start in small, we really want to grow the pathway to work. And Chair, I would suggest that we have a pathway to work. And Taran, it would be perhaps useful to share that with scrutiny members, but I'm sure we can send that around via Sean for people to see. Also, obviously, the work that we are doing across departments. Bill, you'll know Deborah and Newton really well. Deb has been a fantastic addition on behalf of Regeneration to the corporate parenting board in terms of the links that she's brought with the employability agenda in terms of work experience, about the work placement opportunities, the work we've done with HR, with Hannah Brown, in terms of creating this pathway to work, engaging young people. Councillor Jago, you've set us a challenge now in terms of obviously Kickstart. It is a scheme that Regen and Deb has been looking at for creating opportunities in the authority. But what I will assure you today as the Cabinet member, I'll take forward with Taran and with Lisa, a conversation about, for those young people leaving care now, between now and March, that we look to see where they are interested, and it's right and appropriate as part of their pathway plan, that we will look to see if there's opportunities within the authority for work placements for those young people, and we can report that back to committee. So I think Corporate Parenting Board, like yourself, Councillor Smith, the Scrutiny Committee, will continue to monitor this, and obviously we'll feed it back as part of our annual report, but really welcome your interest and your support around support for our young people leaving care.
Okay, thank you very much.
Thanks, Chris.
Okay, any other questions? No. Ian Thomas, I get my words right now.
Thank you, Chair. Taran, it's just a general question. When a young person begins to live independently, how much of a problem do you have with negative peer pressure? And how do you deal with this aspect of things?
I think, Councillor Thomas, we're always very mindful in terms of our planning, because our transition planning for a young person starts when they're 15 3/4. So in terms of those young people being prepared and suitable for independent living, we start very on planning for that. And one of those factors would be about them being susceptible to peer pressure, about them being able to manage a tendency without other young people going to their home and different things like that. If we felt that that was a specific issue, we would look for there to be a transition between them being a looked after young person and going into some form of supported accommodation, so that they would have that additional safety net to support them further. Equally, we start our young person's advisors, start working with our young people when they're 15, and they build up a very good relationship to support that transition and stay involved with our young people then until they're 21. So they, as part of their planning, are always mindful of those difficulties and offer support. So I suppose for us it's about identifying if that's a particular issue for a young person and then working to overcome that before we actually hit those obstacles or difficulties.
Yeah, thank you, Taran.
Okay, Ian, all right.
Yes, thank you, Chair.
Are we happy? No other questions?
Yeah.
Task, thank you very much. I do appreciate it. Every time you come here, you give a better report.
Chair,
No? So thank you very much. I do appreciate it. Sean?
Yeah.
Sorry, you're gonna come into bed now before we close this debate down?
Yes, I've just got a few actions that I noted for this particular agenda item. And if I just call them out, if there's anything different, please let me know. So what I've captured for this particular agenda item is just in a general observation, was to possibly capture more information on 5.7 where the work experience is going to be undertaken for any future reports. There's another action which would be the pathways to work update. Councillor Chris Davis very kindly offered to update the members as and when that information is available for the pathways. And then the last one here then is to explore the Kickstart options as a corporate parent for our young people and report back to members with any findings in due course. So obviously there's no time restraints to that, and I've captured that for Councillor Chris Davis and Taran, if that's okay. Does that cover what we've spoken?
Do we mention there's the numbers as well? How many children going through?
That was in the previous item, but I can add that to that. That was
how many children are going?
Oh right,
okay.
Care leavers
are going through the system.
Yes, okay, I'll add that to it. Yeah, that's no problem. So is that it all for this item?
I say I can't see nothing else.
I just asked about the numbers of putting a figure against our care leavers annually. I know it does fluctuate year on year, but just just to see where we're at this point in time, and even a comparison from a previous year, so we've just got an idea. And the other thing I asked for was with regards to the looked after children, there was a section in this to celebrate the success of the results of the children, and just a little bit more breakdown of that. How many had SAT examinations, what their results were, and what was the remaining really.
Okay, No problem. I've got those down, but obviously that information is information to be added to any future report and not a specific action as in to be done within the next few months. It's for the next reports.
Yeah.
Okay.
And you're going to get us through education.
Yeah, thank you.
Okay, so are we happy with that? Thank you very much. I do appreciate that.
Thank you.
These can I come back to you now before I go back on the next agenda? Or you?
Yeah, that's fine.
I should have said earlier on, can we have an update on the coronavirus in our care rooms? But I think members want to know, especially you said earlier on that our care rooms were one or two other problem. Do you mind?
You want a verbal update now?
Yes,
Yeah?
please. I should have said in the beginning, so my fault.
Okay. I mean, obviously from the point of view of Merthyr's care home, so we've got 3, Tbargoed, Tgurnos and Lisbane. Lisbane is free of COVID. There was one staff member who tested positive, so she isolated for 14 days, but is now back in work. And that obviously infection hasn't spread. Tbargoed and Tgurnos both have got infections in there with regards to staffing and residents have tested positive with COVID. What's happening at the moment is that we're having regular meetings to make sure we're, looking at all the health and safety, making sure the staff following protocol, and sort of keeping an eye on things. The Tbargoed was the first to be infected some weeks ago. Those staff have self-isolated and have now, so the first cohort of staff have returned to work. So that was really positive. We've had a number of residents who tested positive, who are also now out of that 14-day isolation, and they've recovered. So that was really positive. And sadly, we did have 2 deaths in Tbargoed and 2 deaths in Tgurnos. 4 of them were sort of, one was in end of life care, so likely it was they were going to pass away in winter. But they were quite elderly, and not that takes it away. It was very distressing for staff and for the families. So obviously that's when we started meeting to look at sort of trying to shut things down. Obviously we stopped visiting some time ago. There is a push from the Welsh Government and the Older Persons Commissioner to start looking at visiting before Christmas, so that we can start planning for visiting to take place. We're doing a piece of work regionally on that, and obviously we'll do our best to make sure that loved ones do see their family members, certainly at Christmas. But we obviously have to also think about the safety of residents, in our homes. With regards to the private sector, most have been affected, staff and residents, with COVID. And I think that's where the problem is at the moment. We are struggling to discharge from the hospital. And we've currently, I think we've got 24 patients who need to be discharged potentially into care homes. But once a member of staff or a resident is tested positive for COVID, then a 28-day count starts. So we can't place within that setting for 28 days unless you've got a care home like Greenhill Manor who've got different wings so they can separate and isolate. But it's difficult when you've got dementia and you may be a wanderer. We can't isolate them in their rooms, so it's more difficult to do it. So that is something we're looking at now about, placing those people. We're not the only local authority in the situation. Nationally, those discussions are taking place. The second wave, care homes have been more affected than the first wave, because we kept it out of the care homes in the first wave. But unfortunately, more and more staff are asymptomatic. They come into work with, they haven't got symptoms, they're not ill. And I think that's probably how the virus has spread more this time. So what's happened, staff are now being tested weekly. And if there's any symptoms at all, then they're sent home. They're having their temperature taken before they come through the door. If there's any concern about their temperature, they're not allowed into the unit. And that's the way we're managing it. Ange, have I missed anything or anything you want to add?
No, thanks. I think that sums it up really, where we are with the care homes. Working as closely as we can with Public Health Wales and our health colleagues to put systems in place, including looking at the discharge arrangements that's been agreed at Gold, to ensure that anyone who's discharged from hospital to a care home has negative tests before or prior to them being discharged. And equally, if anyone's in the community who is needing to go into a care home, there's also arrangements in place to access testing to ensure they test negative before going in. Thanks.
Can I say thank you both? Very good. All right, members, so we had a bit of an update. So we'll go back on the agenda now. But it's come here a bit of update every scrutiny meeting.
Yeah,
Just
that's
in case.
fine. I'll make sure I
Alright
got
with you?
something written down next time, so that is you've got. So if there's any specific questions you want,
Yeah.
you want answered, then let me know beforehand.
Okay, all right, members, happy with that? Okay, we'll go back to the agenda now, and that's the forward program. Sean? Go on, left us.
I am, and you. Okay. Okay, so with regards to the forward work programme, the next scrutiny will be on the 5th of January. The details of the forward work programme is on page 24 of your report. The two reports that are coming are the adults services strategies and the children's services strategies. We'll be looking to the reports to identify the current position statement for 2021. In the report, it actually states there on page 24 that it's 1920. Unfortunately, that's an error. So we'll be looking for both the head of adults and the head of children's services to give a position statement on 2021. And they should identify also any key areas for development of improvement going forward for the remainder of 21-22. For the remainder of 2021 and going forward to 21-22. So there's two reports for the 5th of January. Would any of the members like to make any alterations or add any reports onto that?
I think we'll keep it as it is, and we can bring it forward. Because we are looking for next year when Taran has done the workshop on the new structure for social services, adult and children. We can put that on the work programme for us to scrutinise it. So I met with Sean and I spoke to Lisa, so that we want to change the work programme in a way that we're dealing with with the department and not ad hoc type of things. All right.
Yeah.
Are you happy with that?
Yeah.
Okay. Thank you.
All right.
Thank you
And then, the scrutiny referrals. I haven't got anything. Anything, Sean, or Phil? No updates? Nothing?
Nothing from me at the moment, no.
Okay. Reflection and evaluation of the meeting. Are you happy the way it went?
Yes,
Thank you.
thank you.
Yes. Happy with that, thank you very much. Okay. So number 8, any other business? I haven't got any. So I declare the meeting closed and I'll see you up at 5 minutes.
Yeah.
Thank you.
Fab, thank
Bye-bye.
you.
Bye-bye.
Thanks, everyone.
Thank you.
Bye, all.
Yeah.
Thank you, Mr.
Bye.
Chairman. Thank you.
Bye bye. See you, Sean. Sean, love.
Well done.
Thank you.
Cheers, Bill. Thank you very much.